Now I will introduce. This is an amazing case, an interesting case of this young male patient. This young male patient who has come to me with not symptomatic. There is no any complaint. There is no any symptom. So he referred to me for the hysterectomia and some of the pharynx. So this MTC been ordered for this patient to see an interesting, which is lesion, this mass lesion in the right maxilla. So this lesion is destroying the marrow bone of the right maxilla with no any symptom, not any complaint. Another symptom you can see, this is a huge right deviated of the nasal symptom. So I've asked the patient if there's any obstruction of your nose. He tell me that the respiration is so normal. ببلاتي راستي طبيعية
نظام شكله ما عزيز شكله كي
أبدا
أبدا
وتدبر إيش ما يشتننا. So there's amazing, which is called the silent lesion in this patient. This lesion is a silent lesion. So the silent lesion usually let me think in an tumor, but slowing in growth. So in the right side, so complete obstruction on this right nasal passage. Can you see this is a huge deviation of the septum? So but the patient don't complain any restriction of the respiration. Some other interesting anomaly of the anatomy of this sinus patient I will introduce. Can you see on the right side huge sphenosinus on the right side compared with the left side? This is a small sphenosinus in the left side and dominant right side sphenosinus. All this anomaly, or we can see anatomic, not abnormal landmark, but the patient don't complain any symptoms. So in any patient, the evaluation should not depend on the clinical evaluation, but we have to combine between the clinical and the anatomical and the radiology. All these three investigation we have to connect with us to make the correct diagnosis. So I would say not every septal deviation has to be operated. This is number one. Not any abnormal anatomic landmark may be symptomatic in the patient. And this lesion may be tumor, so I would now order MRI to make the correct diagnosis of this lesion.